Hi, I'm Dr. John Alevizos, and I'd like to talk to you about my two favorite methods for weight loss, with the doctor's help for weight loss other than diet and exercise. Number one is the HCG diet. Basically, we all have three types of fat. One is structural fat. That's the pad of our hands. That's the pad on our feet and our heel. That's the pads, the fat pads that hold our organs together when we run and jump so they don't bang into each other. So we have structural fat. The next thing is normal fat. We worked right through lunch. It's 6 o'clock and we haven't eaten. Well, that fat was used as energy. And the last is abnormal fat. That's the stubborn fat around our waist, our lower halves, depending where we store our fat. Every calorie restriction diet in the world, first people lose muscle, then they lose structural fat. Once again, this is structural fat. So they might have migraines, they might feel weak, they might look drawn. Then they lose normal fat. The last thing they lose is abnormal fat. Except for the HCG diet, the muscle is preserved, the normal fat is preserved, the structural fat is preserved. The only fat that is used is the abnormal fat. Why is that? HCG is the woman pregnancy hormone. You shoot it once a day for 40 days, and the body thinks you're pregnant. First 2 days, you eat everything in sight. You eat 4,000 or 5,000 calories if that's possible. And day number 3, you cut down to between 500 and 1,000 calories, and we can talk about each patient is different. And the body thinks, oh my God, this baby's going to starve, because the first 2 days that you did the HCG, the set point is 4,000 or 5,000 calories. So the other 3,000 calories that you don't consume day 3 till day 40 comes from only structural fat. So that's one way of doing the HCG diet. The other way is calorie restriction diet Phentermine. Phentermine has been around since 1959. It's the better part of the fen-phen diet. They took fenfluramine and dexfenfluramine off the market in 1995. They're saying 22 women out of 6 million got heart valve disease. Those were disproven. Nobody got paid anything in those lawsuits. However, the phentermine is an appetite suppressant, and yes, with the phentermine, you will lose some muscle, you will lose structural fat, you will lose normal fat if you do not exercise, and if you restrict your calories to an extreme. I explained to you how to do that. Most people with phentermine don't exercise. They'll lose 10 pounds the first month, 8 pounds the second month, 5 pounds the third month. Why? The metabolism goes down due to them not eating and not exercising. However, both are effective ways. The more permanent way is whichever one of these you choose. If you choose a diet that's proper and a regular exercise regimen, whatever weight you lose with the HCG and or the phentermine, you will keep it off. Thank you. If you have any questions, I encourage you to come to the office, come in for a free consult. I'll talk to you and explain it to you. Thank you.